But first, trans women, finally. Trans women patients are to be banned from women's NHS hospital wards. The Health Secretary has announced earlier today. Steve Barclay, speaking at the Conservative conference, said he wanted to push back against wokery in the health service and said the move will also see sex-specific language returned to the NHS. What does he mean by that? Well, terms such as breastfeeding will no longer be replaced by chest feeding. And health advice aimed entirely and only at women, like about the menopause or diseases like cervical and ovarian cancer, they will actually include the word women in the advice. What's not to like? Of course, these measures are to be welcomed and applauded. It's common sense and it's what the vast majority of people in this country want. Biological sex is a fact. Women cannot become men and men cannot become women. When it comes to healthcare, those facts matter more than feelings. But let's just stop for a moment and consider what a state we must be in when the Health Secretary of our country has to go on stage and publicly announce to the nation that only women patients are going to be allowed to be treated on women's wards in NHS hospitals, and that health services that are only applicable to women will stop pretending that men can also have periods, stop having periods and go through the menopause, or die from cervical or ovarian cancer. How far must we have gone down the rabbit hole into the weird and wonderful world of woke that this even needs saying out loud? Why did anyone ever think that trans women, let's call them what they are, men, should be put in hospital beds next to vulnerable, sick, often elderly women who would be forced to sleep and undress with men just yards away? And I don't mean men who've undergone years of hormone treatment and surgery to live their lives as if they were women. I mean men who simply put on a dress and a wig and tell the ward nurse that actually they've identified as a woman since last Wednesday. It defies belief. Yet that was actually the official NHS guidance announced in 2021 under this Tory government. Meanwhile, Suella Braverman is going to announce in her speech today that sex offenders will face a lifetime ban on changing their name and gender in an attempt to close a loophole that allows criminals to evade the sex offence register. Another good move. But again, this wouldn't be needed if ministers and officials had listened to women's and children's rights campaigners who've been saying for years that the laws allowing men to change their legal gender effectively wiped clean their criminal records and enabled them to target fresh victims. We have got to end the madness. These measures announced today aren't about being anti-woke or being unkind to trans people. They're not an attack on trans rights. They're about the fundamental rights of women and children to be safe from predatory men and for women to get the healthcare they need without it being wrapped up in a rainbow flag that allows the feelings of a few to trample over the lives of the many.